of the trends of the state's illicit drug trade. Here's the latest data from our forensic chemistry units in the state now cite these as the top 10 submitted drugs to our state laboratories. And as you look at the list, you'll see a couple that are very concerning. Number 3, of course, fentanyl, the most deadly poison that we are seeing that is mostly involved in the vast majority of our overdose deaths. And then I want to make note of number 9 as well, xylazine, that is being mixed in with fentanyl. Xylazine, better known on the street as Trank, is an animal tranquilizer. We're starting to see more and more of it adulterated into the pills, the fake pills that are out there on the streets. And so that combined with fentanyl are rising the number of deaths because of the issue of naloxone not working directly on the xylazine issue. And so I know there's a lot of work being done to figure out how to create an antidote that will be able to address that xylazine piece that's adulterating the drugs in our systems. The bottom line here simply is drugs continue to be a major problem impacting our state. Addiction wrecks too many families, costs too many lives, and we must do more, all of us. That's why National Pill Takeback Day matters so much. You may not realize it, but theft from medicine cabinets of family and friends is one of the most common and preventable forms of drug diversion. This weekend's event is a great opportunity for Tennesseans to take advantage of the numerous locations across the state of Tennessee to safely dispose of unwanted and expired household pharmaceuticals. If the date doesn't work for you and your family, don't worry. The Tennessee Department of Environment and Conservation, the TBI, our Dangerous Drug Task Force, and the DEA have established a robust household pharmaceutical take-back program. Working with sheriffs and chiefs, along with the Tennessee Department of Mental Health and Substance Abuse Services, anti-drug coalitions across the state of Tennessee have placed more than 400 safe, secure, permanent boxes at offices in all 95 counties that are available to residents to drop off unused, expired, and no longer needed pharmaceuticals from their households. In fact, we have one here in the lobby at TBI headquarters. This program provides an environmentally safe and secure removal option to our residents other than disposal in a sewer or landfill. The TBI uses our existing Dangerous Drug Task Force incident response vehicles strategically located throughout the state to collect and maintain possession of these household waste pharmaceuticals until their safe destruction through the Dangerous Drug Task Force incineration program. By the way, since the inception of the Drug Takeback program in 2016, we've collected and disposed of more than 500,000 pounds of unused pharmaceuticals in Tennessee alone. I'll say that again, 500,000 pounds of unused pharmaceuticals have been removed from the streets in Tennessee. Clearly, it works, and clearly, we can all do something to help. Even if addiction isn't your issue, it's probably an issue for someone you know and you love. And that's what this is about, caring enough to do the right thing. Maybe it's clean out your old medicine. Maybe maybe it's sitting down for a hard talk. Or maybe it's slipping someone the number for the Tennessee Red Line. Join me in doing something to help, because a problem like this one will take all of us working together. Thank you. I'll now turn it over to Dr. Alvarado, our Commissioner of Health.
Well, thank you, Director. Thank you, Commissioner Williams, also. I think we're all here because we know that substance abuse is a significant problem within our nation and our state. one that has touched so many of us and our fellow Tennesseans. I'm so proud of our Tennessee Together partnership and our real work, not just parroting ideals to put into practice what we know is the way to end the epidemic of substance misuse. It's an issue that requires the whole community to solve and the contributions of everyone. It's not just a moral failing, and there are treatment resources available. And long-term recovery is real for many people as well. Tennessee Department of Health continues its efforts and work with many local and state partners to prevent drug overdoses and to improve lives of people and the vitality of communities in Tennessee affected by substance use disorder. Through TDH's Overdose Response Coordination Office and its High Impact Area programs, otherwise known as ORCO and HIA programs, we're working with the local authorities, communities, coalitions, and individuals to prevent addiction and reduce overdoses and overdose-related deaths. The HIA program currently covers 31 Tennessee counties, where the vast majority, about 71% of all drug overdose deaths occur in the state. In just a few years of the HIA program's existence, more than 3,200 individuals have been connected to treatment, harm reduction, and social services for substance use help. The HIA program has also delivered substance age-appropriate abuse prevention education to more than 1,200 elementary, secondary, and high school students in Tennessee. These real results are the reasons I'm grateful in announcing today the CDC's Overdose Data to Action program, which led to the HIA program's creation in 2019, has awarded Tennessee a second 5-year, $5.4 million grant. This means that Tennessee can further strengthen the ongoing efforts to address the substance misuse crisis and reduce substance-related harms in our state. And one thing that we can all do to help be sure that expired and otherwise unused medications are not available to children and to family members is to use days like we're going to see this weekend, National Prescription Drug Takeback Day. This ensures that medications do not fall into the hands of those to whom they are not prescribed, which can lead to overdose or addiction. And I'll close my brief portion of our briefing to note that the important substance abuse treatment resource we launched this year at findhelpnowtn.org. Often there is an immediate, critical point when those that struggling with substance abuse and misuse are ready to receive help. And unfortunately, this is often at the height of a crisis. FindHelpNowTN.org puts information about addiction and treatment resources within immediate reach in real time when individuals and families need someplace to turn. So hopefully if people that see that, they can share that with their loved ones, with people in their community, would be very, very helpful, because when the iron is hot, you need to strike. Thank you for having me as your guest today. I'll now turn it over to Commissioner Williams.
Good morning. I hope this finds everyone doing well. It's always an honor to be able to be with my colleagues, Director Roush and Commissioner Alvarado, as well as Tony Jackson, our director, who will be speaking in a few minutes. As you all know, over the last 3 years after the COVID epidemic that we've had, we have seen a major increase in addiction across this state and across this nation. Research indicates almost a 40% increase in individuals that are struggling with drug abuse. And what that does is that increases the number of individuals that overdose. And we are really hoping that today and this weekend we will get action that will help those Tennesseans across our state so that we can truly make a difference. As you guys know and as you've heard, Takeback Day is about taking those prescriptions that are in your cabinet and taking them out of your cabinet. Simple and easy, because we have these take-back boxes across the state in all 95 counties, as has been stated. So, a couple of examples. If you've had surgery and you kept a few of those pills after surgery, I've done that. Take them back. That's simple. Just take them back. Having them in your bathroom or kitchen or wherever you might keep them might lead your grandchild or a friend or someone struggling to try to take those pills, take them back. Or if you've had a parent that's passed away and you have the drugs that are left from that experience, as we did with my mom about a year ago, take them back. Those need to be safely and securely disposed. Over this weekend, we will have with our partners from health and law enforcement over 100 events where individuals can come together and celebrate hope and recovery and help with this problem. Most events will happen on Saturday from 10 a.m. to 2 p.m. Please find an event near you. Tony will be going over the website. Find that event. so that you can safely and quickly dispose of those medications. The reason that this is important is as you're taking the medications back, you might want to take your child, grandchild, parent, friend, and talk to them on the way about why this is important. Open up that line of communication so if they happen to be struggling, they know that they can talk to you and access the resources that Commissioner Alvarado has gone over. Now, I'm excited to bring up Tony Jackson. He is our incredible Director of Prevention in our Division of Substance Abuse Services. He's going to talk about what our efforts have been in coordination with our partners to save lives. Tony.
Thank you, Commissioner Williams. So, yeah, no, we had Director Roush talk about fentanyl and other drugs that they're seeing in the crime lab. So really today, kind of what has been our response, and it's a coordinated effort among departments on how do we respond to this in our state. Well, we utilize regional overdose prevention specialists, okay? These are individuals who are in the community across the state who educate community members on addiction and substance use. They work to break the stigma around substance use and educate people on it not being a moral failing, but more of it's just like almost any other disease that you can have. But then also in these communities, they distribute naloxone and fentanyl test strips. If you remember last year, we met to talk about the rollout of that, so we'll go over some of that data in a second. So we like to say ropes are saving lives in conjunction with community partners every day. Since program inception, we've distributed more than 500,000 units of naloxone. In the past year, we distributed more than 177,000 units of naloxone. But when you look at it, it's great to have these numbers about how much naloxone you distributed. But what has that resulted in? Okay. So since program inception, we've had recorded more than 66,000 reversals from that naloxone. In the past year, more than 17,000 reported reversals. So you might say, okay, well, so that's what you all do. Who do you focus on? Well, we do focus on everyone from a training perspective. We want to train every single Tennessean on substance use, addiction, stigma, how to use naloxone, so they are prepared, right? But in terms of focus populations where we work to distribute naloxone to directly, individuals at high risk of use, family members that know individuals at high risk of use, people who are in active addiction using substances currently, in an effort to provide them tools that can help them from suffering from an overdose, right? So, big thing from this is training is available to anyone in the state. If you're interested at all, we'd love to provide a training to you on these issues. Next slide, please. And so I mentioned the naloxone piece, and I mentioned that we rolled out a fentanyl test strip distribution program in the past year. What have our results been? Well, let's back up a little bit and think about why it matters. We felt the need as a state, as a department, as partners, and even from Governor Lee, that fentanyl test strips are something that we want to do in our state, and let's see how it works. So as we roll out this program, we said, well, why does it matter? Because there were more than 2,700 overdoses in 2021, fatal overdoses related to fentanyl. So what if there was a tool that could help individuals who are using drugs understand, wow, there's fentanyl in this, I might need to do something different. So in distributing these fentanyl test strips, we've seen over the course of the past year that our data has outperformed similar programs in other states to the tune of 85% of respondents who said, hey, I used a test strip and it was positive. They had a positive behavior change. What does a positive behavior change look like? Well, it might be that they didn't use, okay? They may have used less. They may have turned it back. They may have used with naloxone, as I mentioned before, we work to provide that. And so that positive behavior change provides an opportunity for people to identify the risk that they're taking, okay? So now let's look at the other number. 94% of respondents felt better able to protect themselves. What does that mean? They had a tool that identified an issue, so they understood the risk, they identified the risk. Now they understand the risk. If you understand the risk, research shows that individuals are more likely to want to engage in other supports that may be available to them. And so what that looks like is maybe a ropes, maybe a community partner who gave them the fentanyl test strips. Oh, wow, this was positive. I see that there's a risk here. Can you help me with this issue? And that has helped enhance our efforts to provide additional sources or services resources, and the like to these individuals. So, kind of summing it up, and I know the red line was mentioned earlier, recovery is real. People in all walks of life are living new lives in recovery. Okay. It takes time to get there. It's not immediate. Relapse happens, but providing supports continually to individuals who are in need helps individuals long term. So help is available. The red line is right here on the screen, 1-800-889-9789. You can text or call the red line at any time of day and get a response to help coordinate and access resources available to your community. Thank you.
We'll open things up for questions if there are any.
Yes.
For the drug take-back, the numbers that you're seeing over its inception, or even just this past time in April, how does that weigh compared to the drugs that are still going to be left out on the streets in cabinets? You know, how much of a dent does it really make in what's out there?
Well, we think it's making an impactful dent, frankly. What we know is we start to see that since the inception of drug take-back, we've seen a decrease in that early introduction into addiction by what happens in a home. So we've seen that decrease slightly, not as you heard the numbers from Commissioner Williams, right? Since COVID, 40% more are finding themselves in addiction, and so it's a help, right? Every little step is a step in the right direction, and so these take-backs are having an impact. They are absolutely reducing the supply that's potentially out there, right? So we're not asking people to bring the medications in that you have to have. We're asking you to bring in medications that are no longer needed, right? Those that, as the commissioner mentioned, we've all had some type of, of an incident where you've been prescribed more pills than you're ever going to take. And you keep those, and I know the mindset typically is, well, we're going to keep those because I just might do something and I'll hurt myself, and rather than have to go and purchase, another round of medication, right? So I'll hold on to those. First of all, that's a prescription for disaster. So I would tell you that's the wrong mindset, right? The mindset should be about safety, right? I understand cost. I get the economic issues that people are facing. But this is really more about the ultimate cost, right? And that's the cost of the lives of a friend or a family member. And so absolutely, the program is making an impact. And the more that we can get off the streets, the better.
And these are mostly expired. I guess some people just look at, most of them are expired because drugs don't last that long.
That's a great point. So yes, most of these drugs have a very short shelf life. And so they are expired, and that's really important, right? And they become poison as they expire. And so that's the other key point to this is, even for someone who thinks they'll take it later, that drug could be dangerous to them the longer it sets. And so it absolutely is another very important point, is that many of these drugs are expired.
And you don't want people just flushing them down a commode or throwing them in the trash. That's why you're having this thing.
Right. As I mentioned, what we don't want is we don't want these ended up in a sewer system. We don't want these ending up in the landfills. That's why we do the take-backs, is to keep them out of our environment, in the environment, because that becomes unsafe for us as well. If it ends up in our water supply, it becomes even more dangerous. And so this is a way to safely remove these items, and we will take care of the incineration. And so you don't have to worry about trying to figure out how to get it taken care of. Drop it off at one of the boxes in the 95 counties. Come out this weekend. As was mentioned, some great education that goes along with this effort as well. Is, there is information that's available for families to have the conversation. It's vital that every family has the conversation. No one's immune from this. And so it's critical that all of us do everything we can to protect our friends and our families.
Do they have to put them in anything certain, or do they just bring the bottle, or can you mix them all in one bottle and just bring one full bottle?
However you want to bring them, we'll take them.
the demographics for overdoses, the age ranges seem to be fairly evenly spread, but 14 and under does seem to be growing rapidly. So what is the TBI doing to address that?
Yeah, so we are seeing a trend with younger people starting to become prevalent in our numbers. And the work that we're doing is working, again, alongside our partners and the drug coalitions throughout the state to educate folks, the young people especially in schools. You know, there's a number of initiatives going on right now that we're utilizing to teach young people about the dangers. There's I won't go too much detail, but there's a new one coming that we are working very closely with the Appalachia high-intensity drug trafficking areas, an education program that started in West Virginia that we are looking at very closely and will soon be introducing into some test schools in the state of Tennessee. And so that's more information will come on that. We're really early on with that, but I'll give you the teaser that it's coming.
Anything else? Maybe one more? Sure. Okay. Are you working at all with any, going into any of the homeless encampments that we have throughout the region to make them aware of this program?
Yeah, so what happens is, again, with our partners, not so much TBI, our folks, but really with our partners, and you know, obviously, Substance Abuse and Mental Health Services, this is their everyday work, and they work very closely with the coalitions. But if you want to address it, Jason, yeah.
Sorry, I don't have enough.
No, you're good.
So, no, I mean, you're exactly right, is how do we reach these communities that may not have the phone in front of them, may not see this on TV, may not see the newspaper. And so our regional overdose prevention specialist, we've got Andrea in the back right here. She works in Nashville. And I know for a fact that what she does is she knows where these encampments are. She's worked with them not just for Takeback Day, but throughout the year since she's been in her role. And what they do is on a regular cadence do outreach to these homeless encampments. And you know, we can go back to what I talked about before with where we work to educate, provide information, provide resources. So that's really just an opportunity to provide additional supports that may not be available to those individuals. So it's you know, it's a whole circuit where we work to kind of make sure everyone's aware of, yes, Takeback Day, but also everything else. Because in those encampments, you know, overdose is a big issue where naloxone is a very good tool to keep individuals alive. Thank you.
Anything else?
Thank you.
All right, thank you guys. Appreciate the time today. As a reminder, there is the box out there in the lobby for video.